taking all of the medicine that we need, and also plan for emergency delivery and giving birth at the hospital. And one improvement we did with this is once we decided to run this project, we hired a doctor, a Malagasy doctor, something that we've never had in the past because we run all the family planning technician and PSI visit. But now we have a doctor on site who takes care of all of these projects. And of course, we run it again through CBDs, and the CBDs can train to visit all pregnant women and provide pregnancy drugs. And these are some results already. There was already 57 women who came to see those CBDs to get advice and medicine on everything. And another things we did also on site is to train all of the traditional birth attendants, because it's something accepted in Madagascar, and it's pretty much everybody goes to see them for birth. And so there are about 40 in the entire area within the 25 and more villages. So we train them about clean delivery and hospital referral, and train them about how to use the kit for delivering baby, all of these kind of things. It's very hard, you know, it's not something really easy because they are all old, and they are all people who didn't go to school, and you just have to do something with it. And also this lady, she's a doctor on site, and she's gonna run a mobile center every 6 weeks in 10 villages first, and if it works, we can spread it to the other area for vaccination, testing women, and also train. We're gonna set up a women's group in every village and try to set up something with them, to train them and just be them the voice of this project within the community also. And all of that, of course, as I mentioned, there's a lot of education going on. And what we do is training of trainer, and then let people from the community to talk to their friends and family. As I said, it's very, very difficult, all of this, because of education. We're going to talk about the challenge very soon. And the same way is with the village outreach. It's all about visiting community often and often to tell them stories, to show them pictures. And definitely the video that we just showed earlier, that's something to take home, to show them that it's not just in Madagascar, it's everywhere, and everybody does something about it. And so every 2 months, 20 villages, 22 schools. And of course, we have a big social marketing project in both conservation and the health project since 2009 now. We don't stop every year having an event about it, and lots of programs. So toward the end of this presentation, we're going to talk about the benefit of integration of the free project, or to improve effectiveness of conservation effort. We share, what I want to say here is how we spread messages on site, that everybody from the free project, they are all asked to spread messages, and in that way you can get bigger audiences. And also the involvement of the community. Once community understand that the conservation is something for them, it's something good for them, and they understand the link between the three pH and E, it's easy for them to accept it and to spread the messages. And also, as I said, the same things, increase community engagement and buy. That was, let's say, quite easy at the beginning, because we had already a partnership existing on site, and we had already leaders that care about the project, understand the link, and also there is an unmet need for healthcare, and it was easy for people to accept it from the beginning. And of course, staff and committee members trained to multidiscipline. And that's something we push a lot with our staff, that everybody has to understand the field to be able to explain it to community. There is some of our staff, for example, on the aquaculture project, they travel a lot to take care of the project. And we ask them we teach them about the link, the PHE, for them to be able to distribute it. And that's the only reason why I can speak here today. As I said, I'm in the east side of the project. And sharing resources and opportunities, which is very effective, it's very cost effective. As I said, once the one team goes on field, you don't have to go, you just tell them what to do, and that avoids cost. And also using the CBDs for all three projects and for anything else, because they have the CBDs in this project. And in the conservation project, we also have the committee leaders, which is spread everywhere in the area, and we use all of them for the same messages. And we hope that helped establish the balance between population and the resources. Some challenges: education, as I said, very, very low. Everybody, not everybody, but there's a lot of illiterate, and it's very difficult to do something with. And another challenge is the CBDs, because with the health project, they distribute everything I was talking about. But from now on, we're gonna train them more, and they will take care of some much more serious medical stuff. And that will be very serious and it will be a big challenge, but it's something to try. And this is another subject. So another challenge is we publish our work through papers like this. And I don't know if any of you have seen the Indian Ocean series by Simon Reeve on BBC. The last one they just released in April. It talks about our project on family planning also, and we got a response from the Catholic Herald about create some controversy and criticized by the religious what we are doing. And it's something. This is something international, but it also happens on site. So on site, the only radio we have there is the Catholic Mission radio. And they don't accept, of course, a family planning project on the radio. The health one, fine, but not the family planning, so it's great. It's very difficult for us. And our main funders is UNFPA, MacArthur Foundation, and USAID. And then thank you. That's all I can share today. Thank you.
So if anybody has any questions, I would just encourage you to use the microphone because we do still have some translators with us this evening. And if you don't have questions, we do.
Thank you. Congratulations for the presentations. I'm here from Spain, from a nature conservation organisation. And it's a country, as I imagine, with many other developed countries, where there are conservation projects about restoring degraded ecosystems. And sometimes we're concerned that with invasive species, disease-bearing species coming into the country through increased mobility, and with climate change making it more easy for these species to colonize, there are concerns that there are movements against these restoration projects because we may be creating habitats for these, I'm particularly thinking about mosquitoes and wetland restoration. We may be creating habitats for these species to colonize, and this gives people an argument against ecosystem restoration, in this case wetland restoration. And I wondered whether any of the research programs that you've been summarizing are taking this into account. There's an understandable focus on developing countries in the work that you've summarized here. But if we want to make arguments for ecosystem restoration to fight against climate change, we have this counter-argument, which seems to be an effect of climate change with disease-bearing insects colonizing the restored wetlands. I don't know if there's anything you want to comment on from that point of view. Thank you.
Carter, I don't know if that's something you could speak to a bit, since you were talking a bit about developed countries in your presentation. I think we should grab the mic though.
Yeah, I mean, I think probably should direct that to someone else, since I haven't really been developing that process. Trying to make it better for Steve.
Okay. And we can certainly make sure to pass along the information of her colleague that she was speaking about earlier.
Okay.
I don't know, Gildas, if you had anything that you could add to that, or if Steve's the best person for that question.
Not really.
Yeah.
Can I comment on that?
Sure. Just the mic, please.
Thank you. I'm from Israel, but for the past year we've been conducting kind of a research collaboration. I'm from an NGO, collaboration with the Ministry of Environment, with a division that is in charge on mosquito eradication for health reasons. And we've been trying to check with them which are the best way to eradicate mosquitoes and to continue to maintain ecosystem health on wetlands. And we have found, and we've built kind of a matrix that shows that as healthier as the ecosystem is, less mosquitoes. And I think that maybe through a collaborative work of ecologists and mosquito experts in the right authority, I don't know if it's the health department in Spain or whatever, it really helped, the mutual work really helped to mitigate lots of suspicions between the two bodies. So I can tell you that after a year, not everything is worked out, but there are the demands that they had about which means to activate on each habitat are much sensible now. So it might help to just suggest a mutual work like that.
Okay, thank you. There is a lot of knowledge in the audience too, of course, so certainly if questions are asked, feel free to answer them amongst yourselves. Were there more questions? I did want to express my appreciation, all of our appreciation for, it's 9 o'clock and some of you have probably been here a good 12 hours at this point, so we do appreciate you taking the time to attend our session and stay through our session. We'll be here for a few minutes after if anybody's interested in some of the resources, or if anybody did want to see those 3 minutes, we're here. Please take them, so I don't have to take them back. Thank you.